Hi everyone! My name is Kristine. I am a public health coordinator from the Hepatitis B Foundation. Today I'm going to share some common test results you'll see if you're tested for hepatitis B virus. The blood test is usually a 3-part panel test that looks at the hepatitis B surface antigen, hepatitis B surface antibody, and the hepatitis B core antibody. Don't worry, even though there are 3 parts, you only have to get your blood drawn once. Before I start explaining test results, here are some terms that you should know. An antigen is a substance that sets an alarm in your body to protect itself from a foreign organism or pathogen like the hepatitis B virus. An antibody is produced by the body to protect itself from an antigen. Antibodies bind to and often inactivate antigens. In a typical test, the hepatitis B surface antigen, or the HBsAg, tests for the presence of hepatitis B virus. The hepatitis B surface antibody test, which is also known as the HBsAb or the anti-HBs, tests for antibodies against hepatitis B virus. It will tell someone if they have immunity or are protected against hepatitis B. The hepatitis B core antibody, which is the HBsAg or the anti-HBC test, does not show if you have immunity, but it can tell someone if they have been exposed to the hepatitis B virus. People should be vaccinated when they are non-reactive, in other words, negative for the surface antigen, surface antibody, and the core antibody. This result means that someone has not been exposed to the virus and it's possible for them to get infected with the virus. If someone sees these 3 negatives, it is important that they get vaccinated. When people are non-reactive for the surface antigen, but reactive, in other words positive, for the surface antibody, then they are immune against the virus. They may have gotten immunity from getting all 3 shots of the hepatitis B vaccine, or they recovered naturally. If you have been exposed to the virus and recovered, you should have developed a surface antibody. This test result would indicate that you have recovered and cannot infect anyone else. 90% of healthy adults who were exposed to the hepatitis B virus recovered on their own and developed the protective surface antibody. However, 10% of infected adults are unable to get rid of the virus and develop chronic infections. Their test results would say that their surface antigen is positive, surface antibody is negative, and their core antibody is positive. These people need further evaluation by their liver specialist or a doctor knowledgeable about hepatitis B. People who have an unclear result, like a negative surface antigen, negative surface antibody, and a positive core antibody, should talk to their doctor because there are several interpretations that are possible, and another test may need to be taken. Understanding your hepatitis B blood test results can be confusing. It is important to carefully discuss your test results with your healthcare provider. Be sure to have your doctor clearly explain the results to you so that you fully understand your situation. In addition, it is helpful if you request a written copy of your blood test so that you can be sure you know your test results. Thank you for watching this episode of A Day in the Life of a Public Health Coordinator. Be sure to follow us on social media on Twitter, Facebook, and Instagram, and also check out our last video. Thank you for joining. Bye!